I really appreciate you both taking the time to speak with me this morning. My first question goes to Dr. Minkin. When did you first become aware of Whitney? Any memory of that?
Oh, that's a good question.
My guess.
It's been several years, and I know, you see, I must confess some of my clientele is a little bit older, but certainly even my older ladies love her, so that's great.
Good answer. I thought you might say, well, I'm a big Howard Stern fan, and I love Whitney's appearances on that. But whatever it is, Whitney, you've never been...
She's at 6 a.m. She's, looking down the canal of women already. She's not listening to Howard Stern.
Baba Booey. Anyway.
Not too often, that's true.
Well,
Baba Booey, yes.
Well, Whitney, you've never been shy in your comedy, but of course you're outspoken about great causes, which a lot of people, they're outspoken, but not about great things. In your case, what made you first want to talk publicly about sexual health, reproductive health, all those kinds of things without fearing a backlash?
And thank you for saying that I'm not shy. I'm so glad I come off that way, but I think, in stand-up, you see, just the bravest part of what I get to do in practice. There's a lot of behind the scenes, work that no one ever saw, where I was, scared and confused and very much wanted to give up on saying the word vagina, because I got so much backlash and it's so fraught. And it took me a long time to not be shy about it, because when I first was going on stage and saying vagina, people would, groan and roll their eyes. Women would cheer. Sometimes grown women, would look at their husbands like, don't think about her vagina. It was just, there was so much. And there were times where I was like, this just might not be worth it, because I was being labeled a dirty comedian, a blue, raunchy comedian. It's like, why is the word vagina raunchy? And why does everyone say they're fifi and they're foo-foo and they're the JJ and like, why, so it was kind of news to me that it was that big of a taboo. I know growing up, like, I didn't get the birds and the bees talk, tampon commercials and period commercials, they'd pour like neon blue into the pads, so I got all the bad information. I got trained to believe that vaginas are like stinky and too hairy and they need to be douched and clean. So I just got all these messages that like, this is a thing you should be embarrassed about. So it took a long time for me to be, brave around it, but I sort of, I sort of get off on making people have to think about something that they want, that makes them uncomfortable, because I think that's where progress is in any way.
Those are some good points, that stand-up has changed, advertising has changed. Now, Dr. Minkin, for you, has your practice really evolved over time, like I think it has, because people are more comfortable with verbiage and sharing?
I wish they were more comfortable with sharing. I really wish, because I try to teach my medical students to be able to comfortable and walk into a room and say to somebody, hey, how's your vagina doing? Because we want to be here to help. And that's important. And I wish my patients could do this. And I hope they're taking lessons from Whitney too. But a lot of stuff has changed. And indeed, when I started practice 40 years ago, we of course had birth control pills. Thank goodness they had arrived on the scene and allowed women to take some control over their reproductive health as far as timing pregnancies. But the problem is they were not the be all and end all. I mean, they were great, but the problem is we're human, and I guess that's a problem. And we have to remember to take a pill every day for it to work. And unfortunately, there are plenty of studies that show that women can forget 3 or 4 pills a month, and that's a lot, especially if you got 2 pills back to back, because that can spell a pregnancy. That's not what we're taking the pill for. So what has emerged over the last few years is this concept of long-acting reversible contraception, which is great, because indeed that, this would be contraception that would be in place every day. You don't have to think about, I'm taking a pill every day. That's what I need to do. Things like IUDs, implants, stuff like that, which were great. But the problem is those also entail a visit to a healthcare provider to put them in, maybe a little discomfort. Also, you have to visit somebody to take them out. If you're having a problem with it, you have to take it out. And this became a lot more involved. So the key question was, could we have a long-acting reversible contraceptive with the benefits of the pill without the hassles of it, and something controlled by the woman? That's what you really want. And indeed, about 2 years ago, arrived on the scene a contraceptive method which seemed to answer all that for women women. And this is the Anavera ring, which is a very lovely contraceptive. It's extremely low dose as far as hormones. It's in that aspect, similar to the birth control pill as far as hormonal, but really low dose. But the thing is, you don't need a visit to the doctor to take care of this. That this is woman-controlled contraception. This is a ring, basically got one right here, and that indeed the woman can place this in her vagina easily. It stays there for 3 weeks. She then takes it out, gets her period. A week later, puts the same ring back inside. Okay, this thing has enough hormones to last her for a good year, and so that she doesn't have to go to the pharmacy on Sunday when the pharmacy might be closed or things might not be available. She's got control of the contraception. She puts it in, she takes it out. She can use the same thing for a year. And the other good thing is, if she wants to have a baby or just stop using it, she just leaves it in the package, and that's it. So that she's in control. So you have the advantages of long acting. You don't have to remember something every single day, but she's in control. And I think that's what we're really interested in. And that's part of our Just Say Vagina campaign. We want women in control, be able to discuss these issues and feel comfortable with their healthcare provider discussing these kind of issues.
Well, a quick question for Whitney, and then Dr. Minkin and Whitney, I'll have a quick question for both of you, being mindful of your time here. And that first question for Whitney is there a topic and any topic at all that you're still not comfortable talking about? Because obviously this is one of the most toughest things that anyone could talk about.
My deal is, there are definitely tough things to talk about as a comedian. There's this new thing where comedians are supposed to be like political pundits and like tell you how to vote and like lecture you, and that's not what I signed up for. I didn't go to I didn't major in political science. I'm not a doctor. A lot of comedians think they're doctors now. Yeah. And take this vaccine, don't take this one. It's like, what with what medical degree? So I tend to choose to stay out of things that I am not an expert on, but I am an expert on my vagina. So I like to I really like to just talk about things I'm qualified to talk about and stay away from the incendiary, flammable stuff that, happens in the news that is sort of or politics mostly, because I think that people need to be able to go to a safe place to be able to laugh and not feel like they're going to be yelled at for their choices. The same way I want people to have choice with their reproductive rights. I want people to, if they choose to come to a comedy show, I want to make sure they're laughing and not being lectured. The same way I want to be able to go to a gynecologist thinking I'm going to get a lot of birth control options, and they're like, oh, well, this is, no, so I wouldn't want to be sort of tricked either. So I choose to stay out of a lot of stuff, frankly.
And then the last thing I have to ask both of you, besides, hey, Therapeutics MD is awesome and all that, best place to find you both on social media about all these great projects that you've got. You first, Dr. Minkin.
Well, I just encourage people to go to justsayvagina.com and read about some of the thoughts that we've tried to share as far as being comfortable talking about it. And for more information on the product, they can go to anavera.com. Get some information right there.
And we've been doing some really funny videos that are on my Instagram, their Instagram too, but also mine. And I'm just Whitney Cummings.
Well, thank you so much for your time. Keep on doing all the greatness you're both doing. Seriously. Thank you.
Thank you.
Paltrocast.